Welcome. We're not just going to memorize muscle names, we're going beyond that. We'll be exploring precise structural relationships, how muscles actually connect and how they interact to produce movement. This isn't about rote learning. It's about developing a three-dimensional understanding. We want you to be able to visualize the muscles working in any exercise. This understanding will fundamentally transform how you coach, how you prescribe exercises, and how you design programs. You will be true anatomy experts, so you will give your clients the best possible training programs. Our approach is methodical and practical. We'll examine muscles by first identifying precise attachment points, then developing a clear mental image of how muscles relate to one another spatially. This approach prevents the common confusion that occurs when students try to memorize muscle actions without understanding structural relationships. By knowing where muscles attach and how they're positioned relative to joints, you'll naturally understand their functions. Think of this as developing an anatomical GPS that confidently navigates the body's muscular system. As we proceed, I encourage you to visualize these muscles on yourself and your clients. This spatial awareness will transform your ability to design effective exercises and understand why certain movement patterns produce specific results. The trapezius is a prime example of how muscle architecture directly influences function. This expansive, fan-shaped muscle has attachments spanning from the skull to the lower thoracic vertebrae, converging on the scapula and clavicle. The upper trapezius fibers attach from the occipital protuberance and upper cervical vertebrae to the lateral clavicle, creating a downward and outward fiber direction. Middle fibers run horizontally from mid-cervical and upper thoracic vertebrae to the acromion and scapular spine. Lower fibers attach from mid to lower thoracic vertebrae to the medial scapular spine, creating an upward diagonal fiber direction. These varied fiber orientations create distinctly different functions. Upper fibers elevate the scapula, middle fibers retract, and lower fibers depress and upwardly rotate. Understanding these architectural differences explains why a single exercise cannot effectively target all trapezius regions equally and informs our exercise selection strategies. Beneath the trapezius lie the rhomboids and levator scapulae, which provide critical stability and positioning control for the scapula. The rhomboids run from the spinous processes of C75 to the medial border of the scapula, featuring parallel fibers with a diagonal orientation. Though anatomists distinguish between rhomboid major and minor, functionally they work as a unit. The levator scapulae attaches from the upper cervical transverse processes to the superior angle of the scapula with a nearly vertical fiber orientation. These muscles are often undertrained due to their deep positioning. When designing exercises for these muscles, focus on movements that emphasize scapular retraction with slight elevation, and consider that their optimal development requires conscious activation cueing due to their position beneath more superficial musculature. The serratus anterior and pectoralis minor are critical anterior scapular stabilizers with opposing functional roles. The serratus anterior originates on the lateral surfaces of the upper 18th and 9 ribs, with finger-like projections converging on the anterior surface of the medial scapular border. This architecture creates a powerful protractor and upward rotator of the scapula, crucial for overhead movements and scapular stability. The pectoralis minor attaches from the anterior surfaces of ribs 3d5 to the coracoid process in a fan-shaped arrangement. This positioning makes it a scapular depressor and downward rotator. When overactive or shortened, pectoralis minor contributes to forward shoulder posture that can impede overhead movement and contribute to impingement. Understanding these opposing functions helps explain how imbalanced development between these muscles affects shoulder mechanics and informs corrective exercise strategies. The rotator cuff muscles are primary dynamic stabilizers of the glenohumeral joint, collectively functioning to center the humeral head in the glenoid cavity during movement. The supraspinatus sits above the scapular spine, courses beneath the acromion, and attaches to the superior facet of the greater tubercle. The infraspinatus occupies the infraspinous fossa and attaches to the middle facet of the greater tubercle. The teres minor runs from the lateral scapular border to the inferior facet of the greater tubercle. The subscapularis covers the anterior scapula, attaching to the lesser tubercle. Rather than viewing these as separate muscles with isolated functions, understand them as a coordinated complex that works together to maintain optimal joint positioning. When designing rotator cuff training, emphasize controlled movements with moderate resistance and higher repetitions to develop the endurance and neuromuscular coordination these muscles require for their stabilizing role. The deltoid has a complex three-dimensional structure that explains its versatile function in shoulder movement. While commonly divided into three portions, anterior, middle, and posterior, these actually form a continuous muscular sheath wrapping around the shoulder joint. The anterior fibers originate from the lateral clavicle, middle fibers from the acromion, and posterior fibers from the scapular spine. All converge to attach at the deltoid tuberosity, approximately halfway down the lateral humerus. This extensive insertion creates a significant moment arm for shoulder movement. The varied fiber directions explain why different exercises preferentially target different deltoid regions. Front raises engage anterior fibers, lateral raises target middle fibers, and reverse flies activate posterior fibers. Comprehensive deltoid development requires movements that challenge all three regions through varied movement planes and resistance profiles. The upper arm musculature has a more complex architecture than commonly appreciated. The biceps brachii has two heads, the long head originating from the supraglenoid tubercle and passing through the bicipital groove, and the short head from the coracoid process. Both converge to attach on the radial tuberosity, with the bicipital aponeurosis extending to the ulnar fascia. This makes biceps not only an elbow flexor, but also a powerful supinator. The triceps has three heads, the long head from the infraglenoid tubercle, the lateral head from the upper posterior humerus, and the medial head from the lower posterior humerus, all converging on the olecranon process. The long heads of both biceps and triceps cross the shoulder joint, which means shoulder position significantly affects their length-tension relationships. This explains why exercises like incline curls or overhead triceps extensions create different challenges compared to standard variations. Several important muscles lie deeper in the arm structure. The brachialis is positioned beneath the biceps on the anterior humerus, attaching to the coronoid process of the ulna as a pure elbow flexor unaffected by forearm rotation. It provides consistent flexion force regardless of pronation, supination. The coracobrachialis runs from the coracoid process to the medial humerus, contributing to shoulder adduction and flexion. The teres major, sometimes called the lat's little body, originates from the inferior scapular angle and inserts on the medial lip of the bicipital groove, paralleling the latissimus dorsis function in medial rotation, adduction, and extension. When designing training programs, consider that hammer curls better target the brachialis than supinated curls, and that narrow grip vertical pulling movements engage the teres major more effectively than wide grip variations. The gluteal group provides the primary propulsive force for lower limb movement and plays a crucial role in pelvic stabilization. The gluteus maximus, the largest muscle in the body, originates from the posterior ilium, sacrum, and coccyx, inserting on both the iliotibial tract and the gluteal tuberosity of the femur approximately 1/3 down the shaft. Its parallel fiber arrangement optimizes force production for powerful hip extension. The gluteus medius has a fan-shaped structure originating from the lateral iliac surface and inserting on the greater trochanter with anterior fibers oriented almost vertically and posterior fibers more horizontally. This architecture enables it to both abduct the hip and control femoral rotation. The gluteus minimus lies beneath the medius with similar fiber arrangement but attaches more anteriorly on the greater trochanter. These structural differences explain why exercises like hip thrusts primarily target maximus, while side-lying abductions better engage medius and minimus. The deep external rotators of the hip form a critical stabilization system, similar to the rotator cuff of the shoulder. The piriformis runs from the anterior sacrum to the superior aspect of the greater trochanter, with the sciatic nerve typically passing beneath it, though anatomical variations exist where the nerve passes through the muscle. The obturator internus and externus attach from the obturator foramen to the trochanteric fossa. The gemelli muscles, superior and inferior, attach from the ischial spine and tuberosity respectively to the trochanteric fossa. The quadratus femoris connects the lateral ischial tuberosity to the intertrochanteric crest. These muscles collectively provide lateral rotation force and dynamic joint stability. Their proper function is essential for maintaining optimal femoral positioning during movement. Training these muscles through specific external rotation exercises can significantly enhance hip stability and may help prevent common movement dysfunctions associated with poor hip control. The hip flexors and adductors provide critical functions in both locomotion and stability. The iliopsoas complex consists of the psoas major, originating from the lumbar vertebrae, and the iliacus, originating from the iliac fossa. These muscles converge to insert on the lesser trochanter, forming the only muscular connection between the spine and lower limb. This positioning makes them powerful hip flexors, but also significant contributors to lumbar posture and stability. The adductor group includes several muscles with varied attachments. The massive adductor magnus spans from the ischiopubic ramus to almost the entire length of the linea aspera on the posterior femur, making it both an adductor and extensor. The adductor longus and brevis attach from the anterior pubis to different portions of the linea aspera The gracilis spans two joints running from the inferior pubic ramus to the pes anserinus on the medial tibia. The pectineus connects the pectineal line of the pubis to the pectineal line of the femur. The hamstring complex consists primarily of three biarticular muscles with a common origin at the ischial tuberosity, but divergent distal attachments. The biceps femoris long head runs laterally to insert on the fibular head. The semitendinosus has a distinctive long tendon that wraps around to the anteromedial tibia at the pes anserinus. The semimembranosus, the deepest of the group, attaches to the posteromedial tibial condyle. Additionally, the biceps femoris short head originates from the linea aspera and joins the long head to insert on the fibular head, functioning as a single joint knee flexor. This architecture explains why exercises like stiff-legged deadlifts, emphasizing hip extension with extended knees, create different training stimuli than leg curls, emphasizing knee flexion with fixed hips. The biarticular design allows these muscles to redistribute power between the hip and knee joints during activities like running and jumping, but also makes them vulnerable to strain injuries when both joints are positioned to create excessive length. The quadriceps femoris comprises four distinct muscles that converge on the patella and ultimately attach via the patella tendon to the tibial tuberosity. The rectus femoris originates from the anterior inferior iliac spine, crossing both the hip and knee joints. The vastus lateralis, the largest component, originates from the lateral linea aspera and greater trochanter. The vastus intermedius lies deep to the rectus femoris on the anterior femoral shaft. The vastus medialis attaches along the medial linea aspera with its most distal fibers, often called the VMO or vastus medialis obliquus, having a more horizontal orientation that contributes to medial patellar stabilization. This architecture explains why exercises like squats with minimal hip flexion preferentially engage the vasti muscles, while movements like sissy squats with significant hip extension create greater rectus femoris activation. Complete quadriceps development requires exercises that challenge the muscle group at varied hip positions to address the biarticular rectus femoris effectively. To apply this anatomical knowledge practically, use a three-step framework for analyzing any muscle's function. First, identify precise attachments and visualize the muscle's position relative to adjacent structures. Second, determine the muscle's relationship to relevant joint axes by analyzing moment arms at different joint positions. Third, consider how changes in joint position affect the muscle's mechanical advantage. For example, when analyzing deltoid function, visualize how its moment arm changes throughout shoulder abduction, minimal at the start position, maximal at 90 degrees, and diminishing again in full abduction. This explains why lateral raises feel hardest in the middle range. Similarly, hamstring analysis reveals how hip and knee positions dramatically affect mechanical advantage, explaining why Romanian deadlifts challenge hamstrings differently than leg curls. This analytical approach transforms exercise prescription from recipe following to evidence-based practice, allowing for truly individualized training design. Understanding muscle architecture has direct implications for exercise selection and technique. Fan-shaped muscles with varied fiber directions, like the trapezius and deltoid, require multi-angle training approaches to fully develop all regions. Biarticular muscles, such as hamstrings and rectus femoris, need exercises that position both joints strategically to optimize training stimulus. Deep stabilizing muscles, like the rotator, cuff, and hip external rotators, benefit from controlled movements, emphasizing endurance and coordination rather than maximal load. Additionally, individual variations in muscle attachments explain why standardized technique cues don't work equally for all clients. For example, clients with high glute attachments may need wider stance widths to optimize gluteal engagement in squats. By understanding these architectural principles, you can move beyond one size fits all approaches to create genuinely personalized training programs that account for individual structural differences